After gathering for about 30 minutes and getting the situation under control, quarantine activities to prevent the spread of Ebola in the Democratic Republic of the Congo have once again faced a major crisis. Health authorities report that medical staff and quarantine workers were attacked in the area with Ebola patients. It was reported that during the safe burial of an Ebola victim, the family and local residents attacked medical staff. The scene turned chaotic for several minutes, forcing quarantine personnel to halt work and evacuate. A bigger issue is that 11 Ebola patients escaped from the quarantine facility during this process. Their exact whereabouts remain unknown, raising health authorities' concerns about further local spread. Ebola spreads through infected bodily fluids, so if patients aren't managed properly and move around, new outbreaks could happen. It has been reported that the background of this conflict lies in the local traditional funeral culture. In parts of the Democratic Republic of the Congo, families and relatives touch the deceased to say their final goodbyes. The problem is that the Ebola virus can remain on the body even after death. In fact, experts warn that the bodies of Ebola victims can be highly contagious. Health authorities use special burial procedures for suspected infections and advise families to avoid direct contact. Still, some residents have attacked medical staff. Some residents reportedly reopened sealed coffins and touched the bodies. This is especially unfortunate since there had been recent progress in disease control. The number of recovering patients increased, while suspected and confirmed cases dropped from over 1,000 to about 400. The World Health Organization and local medical staff found the spread was coming under control, but this incident raises concerns that it could undermine progress in disease control. Currently, health authorities are tracking the whereabouts of the escaped patients and conducting epidemiological investigations to determine if there have been any additional infections. They are also increasing education for residents on Ebola risks and safe funeral practices. However, distrust of medical staff and strong ties to traditional culture still hinder containment efforts. There are rising concerns this could cause a new cluster infection, and the international community is watching closely. If more news comes, I'll make and upload a video. This concludes the video. Thank you.
Ja.